Prostate cancer is the most common cancer in men in the UK. So, what is a prostate? Well, only men have one.
What you've got in here, you've got the bladder, and underneath the bladder is where your prostate sits. So if I just open up that, you can see a bit more clearly. You have the bladder here, and the water pipe that runs through so that you can wee. The prostate sits underneath here. It does an awful lot of things. It's bound up with fertility, with continence, because it helps just keep everything closed there. As you get older, it swells, and that's absolutely normal. That's nothing to do with cancer. It's just a normal part of aging. But as it swells, it can block off that water pipe, and that's why you sometimes have difficulty going to the loo. With prostate cancer, it's a bit different. It doesn't cause it to swell, and it doesn't give you any symptoms that you can see. But what happens is we start getting a bit more of the PSA, which is the prostate hormone that we spoke about earlier, being released from the prostate. And you can get some nodular irregularities in the prostate. It just feels bumpy or lumpy. So when we feel it in the back passage, you can just feel some lumps and bumps there. Sometimes, not always. But the big one is that blood test, because if there's cancer there, it will give us more of the PSA in the blood. That's why it's very important to get both things done. You can't tell completely by just one. You need a full examination. And that's where your prostate is and roughly what it does.
So what can go wrong? Common prostate problems include an enlarged prostate, prostatitis, which is the inflammation or infection of the prostate, or prostate cancer. Common symptoms of a prostate problem include needing to pee more often than usual, day or night, difficulty going for a pee, a weak flow, or needing to rush to pee. But most men with early stage prostate cancer have no symptoms at all. So, are you at risk? In the UK, 1 in 8 men will get prostate cancer at some point in their lives. If you're black, you're at a higher risk. 1 in 4 black men will get prostate cancer. You are 2.5 times more likely to get prostate cancer if your father or your brother has had it. You may also have a higher risk of prostate cancer if your mother or your sister has had breast cancer. If you have any questions or concerns, there is help available.
So today we are at the Acne Center at the very first day of the launch of the community clinic, where people have been invited to come in, black community to come in and have their prostate checked. And also to let you know that it is not anything scary, just a blood test and a physical examination.
The Hear Me Now campaign was a report that I wrote. I actually wrote it in 2013, which was about black men risk. So that's what started it, and I wrote it because black men had higher incidence rates. In other words, they got it more frequently, but they also had higher death rates. That's really what made me write it. So that's why, and it's become a national campaign. I was particularly keen to see that there was an action in Nottingham, my hometown, and this is what this is all about. Check Things Out basically was better than saying prostate cancer risk assessment clinic. What we wanted to do, rather than black men and other men who are affected, because some men have a strong family history. If your father has it, you're 2.5 times more likely to have it. Going to the GPs, if they're afraid of going to the GPs, or if they've just been busy, they could come into the community to actually have the early tests for prostate cancer. There isn't a national screening program, but we know, particularly for men who have no symptoms, there is a blood test and there is a physical examination. So that's what we're doing here at the African Caribbean National Autistic Centre, otherwise known as the Acne Centre in St Anne's, and it means that it's a drop-in service every first Monday and third Wednesday of the month between 9 and 3:30. We've got 2 urology nurses up here, so we're working in partnership with the NUHNS Trust City Hospital Urology Department, and it is funded by Nottingham Clinical Commissioning Group.
I was carrying this pain in my right side, which I thought was sciatica. And then obviously from doing the therapy, I realized that it wasn't working. So then I went back and the doctor did tests, and it came up with the result that I had prostate, which was over 2,000, and that was very high and frightening, of course. So, I've been treated, and so far it came down to 3.6 from my recent test.
I am an acute contracts and cancer commissioning manager for Nottingham City Clinical Commissioning Group. A clinical commissioning group is a member organisation made up of all the local Nottingham City MPs, and our main function is to spend the healthcare budget for the people of Nottingham. So I've been involved in this project for about a year. My main involvement has been helping BME cancer communities and Nottingham University Hospital to design the project, to decide what we were going to deliver and where we were going to deliver it, and securing the funding for it.
I became involved with the Prostate Fab group. I'm a part of the group Fab, and we're the fabulous. We're the women who support our husband and partners to overcome and manage their distress when they are diagnosed with prostate cancer. I became involved because my husband had prostate cancer, and I felt that he needed that sort of encouragement and support, and I feel it's very important to share information with our community to enable men who shine away from being tested to know that it's just a simple blood test, and it's only after the blood test prove anything that you would go for extra checks or extra time with the consultants in examining you any further. So I would say to anybody out there, get the check quite early and save your life.
Hi, my name's Wayne Marston. I was diagnosed with prostate cancer almost 7 years ago now, and the reason why I first got myself tested was 17 years ago. My father died of prostate cancer. At the time I was 35, and my GP said, when you're 45, come back and have a test. So a few days after my 45th birthday, went to have a test, and they detected I had the very early signs of prostate cancer. So I had treatment for that. I had my prostate removed, and after that I did a lot of reflection about myself and maybe raising awareness with other people. And so myself, along with a few other members of FAB, decided to start Friends and Brethren's support group, and we saw a need basically within the community, one, to raise awareness, and to start talking about prostate cancer and how that affects black people.
With prostate cancer, it's a combination of a large number of genes, and in the African and the Caribbean community there's a number of these genetic changes which mean they're at higher risk. There are also some environmental factors which play a role. We don't yet fully understand all of these factors which can affect the risk. We know that green tea and tomatoes, processed tomatoes, can help lower the risk. But the problem is more complicated than just the 1 in 4. We also know that men from this community often present later, and the disease can be more aggressive. So it's really important that if individuals are worried about their risk, or if they have a family history, or if they are over the age of 40 and they're from African or Caribbean communities, they talk to their doctor or come down to a group such as Hear Me Now to talk about the pros and cons of having a blood test and an exam. If you can pick up prostate cancer early, you'll do very, very well.
I just want to say, for those who might be watching this clip, please don't stay in the dark. as men, go and have a check. It's not anything that's going to hurt you. It will help for you to understand what is the process, and that you can able to even stay longer in this land, if you want to call it that way. It is important, to check yourself.
A woman is very instrumental in being involved, because most of us is the one that encourage our husband to actually have the test, because we know that we're not men, we don't know what men go through, and very often there's no symptoms, but a blood test, a simple blood test, can save your life.
The earlier we check it, the better. Let's check things out.